evening. I'd like to call the board meeting for Wednesday, October 23rd to order. Can we have a roll call, please, Mrs. Schlueter?
Sure. Mrs. Evans?
Here?
Mrs. Klein?
Here.
Mr. Nielsen?
Here.
Mrs. Larson?
Here.
Mrs. Witkowski?
Here.
Mr. Alexandrovich?
Here.
And I am here.
Thank you. Has the meeting been properly posted, Dr. Katz?
Yes.
Thank you. Please rise and join us for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Item 3 on the agenda is community comment. Per board policy, we allow up to 15 minutes of resident comment. Would anyone like to make a comment? Hearing none, we'll move on to item 4, approval of the agenda. Would anyone on the board like to make a motion to approve the agenda?
I'll make that motion.
We have a motion by Mrs. Witkowski. Is there a second?
Second.
Second by Mr. Nielsen. Is there any discussion? Hearing none, all those in favor of approving the agenda say aye.
Aye.
Opposed? Abstention? Motion carries. Item 5 is consent agenda. Would any board member like to remove an item from the consent agenda? Hearing none, all those in favor of approving items 5A and B on the consent agenda say aye.
Aye.
Opposed? Abstention? Motion carries. Item 6 is school board announcements. Does anyone have an announcement?
I do. The police and fire spaghetti dinner went very well. Kayla's crew preliminarily raised over $3,400. There's not a final tally yet, but that was the initial count.
There were a lot of people there. Amy and I were volunteers that night. Any other announcements?
I have several. Southwood Glen held their 20th anniversary celebration. It was well attended. It was fun to see all the old pictures and the yearbooks, and I got to see how little my kids used to be and now they're big. That was a little bit shocking. It was good to see old friends too. Franklin High School recently held their winter sports meeting, and I'd like to say kudos to Mrs. Unertl. She laid out the expectations for the student athletes and the parents, and she was very clear and concise, and I thought it was an excellent meeting, so kudos to her on that. Also, Franklin Rec Department runs a program called the Franklin Select Prom Squad, and there's 2 squads there, and they recently competed at Greendale High School's junior high pom competition at Greendale. And the prep squad took first place for elementary poms. The spirit squad took first place in poms, hip hop, and kickline. They had the first place duet, the first place solo and high score of the competition, and they also took a 3rd and a 4th place in solos. So, congratulations to them.
Thank you.
I have a couple things. Debbie reminded me, I wasn't going to say this one, but Debbie reminded me about the cross-country team. The girls won conference on Saturday. The boys took second only by 5 points. It was super close. And the girls and boys JV both also won. In fact, in the girls JV race, the first 12 runners across the line were all Franklin girls. It was really exciting. And in boys JV, the first 4 boys were all Franklin runners. So it was very exciting at all levels. I also attended the Southwood Glen 20th anniversary celebration, and it was really nice. Mrs. Dixon came back, and Missy Moeller, who is now a teacher at Robinwood, was there and spoke. She is an alum of Southwood Glen herself, and she shared a couple of really cute anecdotes that I think the kids could really relate to, which was nice. And then I was also able to attend the book fair at Robinwood last week. They were having their book fair started the same night as their parent-teacher conferences. So I went and I ended up volunteering for a little while and meeting some of the families, and that was a really nice experience too. And I also got to see Mr. Nelson dressed up like a pharaoh because they had an Egyptian theme. So that was a lot of fun.
I also got a chance to attend the Southwood Glen celebration. Got there at the evening event and saw Mr. Trotier, which was a surprise, and He gave a really nice talk about the excitement of planning for the school and how it was really the first school in Franklin that really accommodated some of our disabilities programs, and how they created such a wonderful, warm, inclusive environment. And my kids went there for a couple of years until we got redistricted. But that is such a wonderful school. It reminded me how bright and airy that the building is. It's the best building in the district, in my opinion. Also, I want to remind the board that the foundation auction is also coming up November 8th, and the price goes up this Friday, so act now.
Thank you.
I also attended the Southwood Glen evening presentation with Linda, and it was nice to see Mr. Trotier. He was very emotional. It was great to see him. Very nice.
I did not attend, so. But I just thought, but I did want to give a shout out to the band. They did a competition, and last year when they did the Cudahy Invitational, which I think was their, I don't know how many years they've been doing the competition, 2 or 3, somewhere in there.
This is their first year in the competitive
It
class.
was exhibition.
They were
before,
exhibition.
Yeah, and they got a score of 50-something last year, and this year they got a score of 54 to 70-something. And they were just ecstatic, but as Mrs. Klein can attest to, the kids were very hard. They're there like 6 to 9 in the evenings doing with the color guard or with the band, and then the following week they had the state invitational at Whitewater,
Yes.
and they did really well then too. So definitely seeing some improvements in the band. They're having a lot of fun. They're doing great.
I agree.
Shout out to the band.
And then we cut the ribbon. You want to talk about that?
Oh
We had a brief ribbon cutting ceremony for the new concession and restroom facilities over there. We had the Sabre and board members and students and cheerleaders and so on and so forth. So it was a nice event just to sort of kick that off.
Thank you. Item 7 is the school board calendar. We have a special board meeting on November 6th, 2013 here at the ECC at 6 o'clock p.m. and also a regular board meeting on November 13th here at the ECC at 6 o'clock p.m. Item 8 is the liaison reports. We have a personnel and policy report, a personnel and policy virtual attendance at board meetings. Mrs. Larson.
Yes, the policy, as you look at it, you'll notice will remain, or can remain the same. The only revision that Dr. Miller and I are suggesting that we make to the policy is striking the 24-hour notice portion of that policy, but it is open for discussion. Does anyone have anything they'd like to discuss?
I agree with your recommendation. I mean, we did discuss this at a previous board meeting, and I believe at that time it was kind of our consensus to take that out.
It was consensus to take what out?
The 24-hour notice. Because
When we created the policy? When we created the policy, it first had 8 hours notice in it. And then we had consensus to change it to 24 hours notice.
I think the consensus you talked about was to remove it from the handbook and only refer back to this policy. I don't think we agreed that we were changing the policy. We only were going to not put it in the handbook, but just reference this. I guess we didn't, discuss the 24-hour change really at that time.
That was the
During
one
the
thing that
discussion.
actually prompted the change, because we were gonna take out the 24, it was proposed to take out the 24-hour notice in the handbook, but that would be in contradiction to the policy. So then we decided, yes, we probably should not reprint the policy in the handbook, but refer to the policy in the handbook. So if there are policy changes, the handbook is still current. And so I think now that's why this is coming up tonight, to discuss the 24-hour notice in the policy itself.
And
That's
I
the
guess,
question.
why would we take out the 24 hours? So that we can allow anybody to pick up the phone and attend the meeting, or?
The discussion on that was just in case someone had an event that day, they would have the opportunity to have 24 hours. And then according to policy, they would be not able to be a part of the board meeting. So it was just simply to offer every board member the opportunity, should an unusual circumstance, which hasn't happened here, and maybe it happened once in 10 years, but it is restrictive if you put an hour on just about any policy or a time frame, because there's always exceptions that could come up, and then they can create additional issues for the board regarding the policies for that specific policy.
I think it just leaves the door open for seven of us always to participate in a meeting. It doesn't close the door on anyone that way.
I think we all understand the importance of everyone attending the meeting, so I would think that this would be something that would only be used, you know, if an unusual circumstance came up. So from that standpoint, I wouldn't have a real problem with the 24-hour notice being struck. But I would think if we start seeing where people can't attend and it happens that day and we have people call in a lot, that'd be disruptive too. I don't see that happening, but and then we could always bring it back up for review. So.
I would agree with Mr. Nielsen. I don't foresee it happening anytime soon. We haven't had that situation as of yet. So I don't see it as a problem either.
It still does state, though, the board president will extend that permission. So we're understanding that it's not a given that it's going to be granted. The board president still extends the permission. Okay.
Do I hear a motion?
Yes.
Do I hear a motion to approve board policy 8305 as revised?
I would make that motion.
Is there a motion by Mrs. Larson? Is there a second?
Second.
A second by Mrs. Klein. Is there any discussion? Hearing none, all those in favor of approving board policy 8305 as revised, say aye.
Aye.
Opposed? Abstention? Motion carries. Thank you. Item 9, reports and presentations. Item 9A, annual health report.
This is an annual report that we present to you that's on the health of our students in the district. And Issa Chase is going to be answering any questions, giving you a few details. And then you've had the document to look at, so if you have any questions for her, please feel free to answer.
Good evening.
Welcome.
I also attended Southern Glen in the afternoon. Do you have any questions?
Thank you for all the detail. It's very interesting.
This is the time I'd just like to make a comment regarding ESA, that there's a strong working relationship between ESA and the city health department on a lot of things. So behind the scenes, it's just not the ESA and the nurse, other nurses or people in our district working in isolation. And she's always in contact with Bill Kerr and different people that are trying to stay ahead of the game. Bill makes us aware of things that are coming down the pike and so on and so forth. So, Reese, we thank you for those efforts.
Yeah, we keep daily active surveillance of communicable disease in all the schools, and we report every Friday to the health department, and they tally, and we have ongoing assessment of symptoms that's going on around the schools and in our communities. And there was one trigger for that May 17th closure for Pleasant View, when we started to see those cases and how fast they multiplied. And so it was in collaboration with the health department that we decided to close that one Friday. We had two presentations, two assemblies scheduled for that. So we bring a lot of more people from the community into the building that was, contaminated. So we took the opportunity to do a deep cleansing of the environment. And we were glad to find out the results were not food-related illness. It was a norovirus that was causing that. So it was something we worked very closely. The only other things I wanted to say is that the numbers of concussion, and maybe Dwyer Kathy, here also, we keep a very close monitor in the numbers and accommodations that we need to make for those students with concussions. And they are very, very many every day. And some students have require a lot of different accommodations for their meeting their academic requirements. And some resolve, most of them, 80 to 90% resolve within a week, 10 days, but then we have a group of students who require more attention from the pupil service department. And the last thing I wanted to say is that this year, and it's going to be a year, in November 7th, the rec department hired a school nurse for their department, the before and after school program, and also for their summer events. And we are working very closely with Sue Berkovic also in that. And she's now training and supervising King's Club employees and also the summer employees. There are a lot of students with special needs and health needs in those programs also, so she's taking care of that now.
So, and parents pay for these programs? These are all for fee, correct?
Yes.
So if, are all the fees are the same? If you have a special needs child in the program
Yes.
that requires this level, everybody pays the same?
They have to be.
I guess I was a little surprised by that, because I guess if I were at a child daycare, I wouldn't expect that level of care, but.
But because we look into that because the rec department is part of a school district, we could not discriminate against, any child with special needs to attend programs.
I had a question about the concussions, Issa. Do we keep track of what percentage of them happen at school or at a school-related event versus how many happen outside of school?
We have a Google Doc. In every school, we list the day of the event. Some occur at home, some skiing, or some even in doing swimming, or just recreational swimming around the pool. They fall and they have concussion. Yeah, we follow where it occurred and when and what was how did it resolve? What did the child needed as far as medical treatments, as far as academic accommodations?
I have a question about the emergency 911, the EMS fire. Is that during school hours only? Do you know?
Adam gave me those
Right.
numbers, so I'm assuming.
Do you know, Dr. Katz, did we only have one fire out of those 20s? Was there really only one fire, the one at the high school, or?
Yeah, the rest were false alarms with dust controls and the sensors and those kinds of things.
So it's only now and I ran into Bill, is it Wacker?
Wicker.
Out in the community, and he mentioned to me that regarding the norovirus incident, that the school district handled it just so well. He was so impressed. So I wanted to let you know that he did comment on it. So that was very good to hear. And then I did have a question on the immunizations. To be almost perfect like that, the 18% that aren't getting the immunizations, is it for just
18%? It's 99.82.
That are getting it.
Yes.
Yeah, 0.1, oh yeah, I have 0.18, sorry, that's what I have. Is it just refusal, or is it religious convictions, or?
The parents can sign a waiver, either a medical, personal, or religious conviction.
That's a real good percentage there, it's very good. And the health room visits for Southwood Glen and Ben Franklin, that, they're a little lower, the recording, you said, I know they can't record all of them, and it's very busy, and I give them a lot of credit, the health room assistants. there's such a difference, though, between the other schools. How important is it to record all of those?
I think it's important is how we make decisions for, staffing and for supplies and for a bunch of other decisions that we make.
Does it mean they need more help, in your opinion?
Not necessarily. I think that it's a matter of educating, see that they understand the purpose and the importance of documentation. Sometimes it's just not really understanding what is important enough that needs to be documented.
Or perhaps what the child should be sent to the health room for. In some situations, teachers keep Band-Aids in their desk drawer and rarely send the children, and in other situations, teachers send the children for the Band-Aid. So it could be that as a factor as well.
And the fact that you participated in 215 IEPs with all your other duties?
Well, we have 3 IEP meetings for just planning, yes, and writing the care plan and then meeting with parents.
That's a lot of work on your part.
Wow, keeps me busy.
Thank you, and congratulations on your award that you received also.
Thank you.
We have item 9A, the at-risk report and youth behavior survey summary. Dr. Dwyer.
I believe you respond to the documents. And so I wanted to highlight what would be different about this year's at-risk group. To remind you, most of the students that are considered to be statutorily at risk are habitually truant and they're not doing well in credit attainment or their skill level. So what is the school district doing? And I think we are being pretty effective with the truants. Last year, staff from Student Services had a group of students assigned to them to check in and check out daily to increase their school engagement, their connection to school, and hopefully make them want to come to school. And in addition, there was a lot of family intervention goal setting. Our assistant principal and a social worker went out and made several home visits to also engage students, frequent phone calls, frequent visits. And our current list of at-risk students, they were identified based on last year's data. It's only been a quarter, but their attendance of those at-risk students is close to 100%. So I think that regular follow-up with the social worker and the assistant principal is pretty effective. The schools are closely monitoring student academic achievement through monitoring their response to the instruction, and some of the new strategies that are listed in the booklet, and they're highlighted in yellow, most of them are directly related to some of the strategies that I've implemented or started because of response to intervention, like RTI stuff. So we're getting better data, more regular data on their academic achievement, and we're monitoring their progress, so hopefully their skills will go up, they'll do better in school, we'll have fewer kids at risk. Those are the 2 things that I wanted to highlight this year. They're different.
Do you find that you have some children who just resist all your efforts to help them? And then at that point, what do you do?
Last year, there was one student that remained on the at-risk list. I think they were considered to be a dropout, but it was not because of the district not trying several different things. And I believe we're still trying to reach out to that student to bring them back. If they are resistant, I think there's a lot of persistence on the part of the staff, at least at the high school level. We're constantly reaching out and trying to connect them and negotiate ways to bring them back.
Well, you can see that from the write-up that there's a lot that you do. I just didn't know if you hit some point where you say, no, there's nothing we can do to bring this person in. It's been a couple years, and then what do you do? Do you have any alternatives? You turn them over to the police?
Well, I know Nick's sitting back there, and Nick Cohn is our assistant principal, who I don't think has let us give up yet, so.
I think we do have a lot of options with our alternative ed options. I mean, sometimes the student at risk might not be successful at a traditional high school. We do have those kinds of programs as well as MATC Adult High School. I think in my opinion, and Nick can chime in also, I think the most difficult situations we've had are students who've transferred in who have very few credits and are 18. Once they turn 18, it's very, they have so little credits it would take them forever to make that. And those are the kids that I think are really hard for us to meet that. But I think the students that have been with us, really that's not as big of a challenge because we're on it right away. That's not difficult.
I think that's an accurate reflection of those students that are the most challenging.
And just one question. So I know we have Sabre Academy and Connects, which has more students than what are on this list. So what's the difference between what's on the list versus all the kids that are in those alternate programs?
The students that are on this list are considered to be statutorily at risk.
By the state's rules.
Right. The other students that are in the alternative settings are at risk of not graduating because they're credit deficient. But they may, in order to be statutorily at risk, you need, that's more than a year credit deficient. And some students are 4 credits deficient and they need that to get them to graduation or to make up for an illness or time out of school. So they aren't more than a year credit deficient. But they are credit deficient and they are at risk of not graduating on time.
It's just a more extreme list.
Yeah.
And the
And you need to have 2 criteria. Those kids may have great attendance and be amazing people, but because of a situation, they missed out on credits.
Any other questions? Thank you for all the work in the report.
Okay, great, thanks. I think we're also here to talk to you about the youth risk behavior survey. Okay. Every year, the district is administering the youth risk behavior survey to 7th, 8th, 9th, and 11th graders, and we will do the same this year. And we're here to highlight some of the findings. You'll get a complete PowerPoint of the findings on board docs. There was a miscommunication, so you don't have that right now, but we'll highlight a couple of the things.
Some of the most notable things from the middle school, I'll just highlight 3 things, are that the youth risk behavior survey, for anyone who doesn't know, asks questions to students and then they anonymously answer the questions. So one of the questions was, do you agree that bullying is a problem at your school? Last year we were at about 7.
Could you pull the mic towards you?
Yes, I can. Last year we were at about 70%, but we've dropped our agree that bullying is a problem to about 50%. So that number is still a little high, but we are working on it and we are glad to see that it is going down. Another thing that I know we talked about last year was the students who seriously consider killing themselves question. It has definitely gone down, so we're glad to see that. We've implemented the Signs of Suicide curriculum, which is a DPI-sponsored program, and we're glad to see that it is showing signs of working. And then the other thing that has gone down that we are proud of is alcohol use. It's gone down by about 15%. So those are all really good things. Some of the other strategies that we are doing, we definitely have anti-bullying days. There's a Blue Shirt program that we've kind of taken part of. It's World Anti-Bullying Day. So we wear these blue shirts on Mondays, or the first Monday of every month. And then our guidance department has kind of sponsored some activities in the school for that. Our BOSS program stands for Be One Stand Up Student. This is, I think, our 3rd year doing it, and it's going very well. We have a guidance Moodle. It's just a website where we have different topics that students can go on Moodle if there's a disciplinary action. It's more of a restorative practice. It's not do this, get in trouble. It's do this and learn from your mistakes, and it's kind of an interactive website that they can use. Like I said, our Signs of Suicide curriculum implementation, we've been doing that in the spring, and we're also going to do that with 7th graders this year to kind of help with that. We just have been doing it with 8th graders, but we're going to add 7th grade, and hopefully that will help bring our numbers down more. And then general district-wide anti-bullying efforts. I think this year our guidance departments, guidance counselors are collaborating from all levels, so we have a consistent message.
You ask, do you agree bullying is a problem? And are these state questions or your questions?
These are all state questions. Yeah. I believe the question was percentage of students who agree that harassment and bullying are a problem.
So they don't ask, are you being bullied?
No.
Or do you see bullying?
Not that question. No. That was, do you agree?
Any other questions?
I can let you know what the high school highlights were. Typically, the high school findings are commensurate almost in every area as the state averages. However, this year
It's most notable that Franklin High School's reporting of tobacco and alcohol use is significantly lower than the state average. So I think that's awesome. That's great. I was very surprised and happy to see that. But they did indicate a slightly more elevated identification of cyberbullying than the state average. There could be various reasons for that. One I'm wondering is that we're making students more aware of their behavior. We're addressing it more openly. We're talking about it, and we're really trying to get people to understand what is harassment, identifying what it is, and being able to safely intervene or handle it. At the high school, we too have the Blue Shirt Days once a month, and along with that come announcements and messages that the students create themselves. We're holding a Positive School Climate Summit again on November 13th, and that's kind of a conference for students to encourage them to take leadership and create programs that get students to think maybe before they text or think before they act, and really promote tolerance and acceptance among everyone. So we'll have that. We also engage in restorative practices when there is conflict or harassment among students. There are AODA groups running throughout the school year, alcohol and other drug abuse support groups, education groups, not really treatment, but just ways to maintain their treatment goals, which hopefully is linked to the decreasing tobacco and alcohol use. We have Peers with Impact, a group of students who vow not to use alcohol or drugs, and then they travel to the middle school and teach lessons on how to maintain healthy behaviors and choices. And then the high school is participating in the K-12 district-wide anti-bullying efforts.
When were the surveys taken?
Spring of last year. I think April-ish.
So that wouldn't really reflect the current student population at the high school then, because it was taken?
Correct.
Okay.
But it
It
would
would
reflect the
reflect
10th
the
and the 12th
Yes.
graders.
Yes.
The 10th and 12th graders, because they take it as a 9th grader and 11th, 7, 8, 9, and 11. So it would be this year's 10th graders and 12th graders. So the students are still there, and then hopefully they'll take it again in the winter. I think in the high school, that's how we're going to try and catch everyone. We did not get every student.
And that is one thing with the middle school, 50% of our population changes at the year. So we get this data, and we have basically 1 year to kind of work with them, and then we get the data again, and they go up to the high school. So it's a challenge, but we like it.
And we get to share it with the freshmen.
Yes.
And are parents made aware of any of the suicide prevention type classes? They know that it's pretty serious stuff in there.
Yeah, we do send a parent notice that they can opt out of that. They can opt their student out of participating in that if they want.
And are you involved at all with FAPSU, the community group, the community-based prevention efforts? You didn't mention that at all in your things.
Because I think it was a community group. Yes, there's FAPSU, and I know a couple of you are members of it. I think because it's not school-sponsored, it's community-sponsored. So I didn't put it on our list for what the high schools, we're not taking leadership of that, but we know of it. I think we advertise it a lot.
And there are high school staff members that volunteer to be involved. Mark Finney and Catherine Reed in particular, I'm aware of. But
Thank you so much.
Okay, great, thanks. Thanks a lot.
Mrs. Evans, could we just have the board, they need to approve the at-risk report.
Just that as it is, the at-risk report. Do I hear a motion to, is it the 2013-14? Do I hear a motion to approve the 2013-2014 at-risk report?
I'll make the motion.
Motion by Mr. Schleter, is there a second?
I'll second.
Second by Mr. Alexandrovich. Is there any discussion? Hearing none, all those in favor of approving the 2013-2014 at-risk report, say aye.
Aye.
Opposed? Abstention? Motion carries. Thank you. Okay, we have item 9C, the district health and dental insurance.
Hi again. Here we are. I didn't go to the Southwood Glen, but I actually live in the Southwood Glen subdivision, so I was there by intention, I guess. What I am hopeful that we can get through this afternoon or this evening is a quick overview of where we started last time we were together the recommendation with the follow-up that we were instructed by the board to go forward with, and then just answer any questions that you might have. I know you've got an awful lot of information. Obviously, this is something that we do on a daily basis, so we may use terms and certainly acronyms that don't necessarily make sense when you're reviewing it without a person sitting in front of you kind of going through it. But a couple of things that I'd ask you to keep in mind from the first time that we got together as we go through this addendum. First and foremost, we were very pleased to see as we went to the market this time that we had almost every carrier that has any sort of name recognition in both the state of Wisconsin and the United States bid on the school district of Franklin. That says a lot in this day and age because, quite frankly, a lot of carriers, a lot of insurers and third-party administrators are very much restricting their enthusiasm for new business. They're trying to hold on to what they have because the Affordable Care Act has offered a lot of new opportunities to raise fees, increase fees. People are trying to maintain business that they know something about rather than taking a risk on a new piece of business. So the bird in the hand kind of is worth two in the bush has been a real anomaly in our market this year. And so the fact that you were able to get a lot of attention from the market is still a very, very good sign that you maintain good district health, that you have good high-quality eligibility standards, and that, quite frankly, you know what you're doing. So I want to give you kudos for that because it is important as you go to the market to know what you're looking for, what you want, and what you're trying to do for your employees and your retirees. Secondly, that while tonight we're going to concentrate on the incumbent, which is Humana, and a recommended carrier, which is the Wisconsin Counties Association Group Health Trust, I did want to make sure that we did remember that we had those other spreadsheets. So these were the best of the 6 options, but they're very well done and very well preserved. We also are, in getting into the addendum, we wanted to remind you that there's a definite strategy in being compliant with the Affordable Care Act that leads to this 6-month renewal opportunity and then a follow-up guaranteed 12 months. So 18 months is very critical for the district. It helps keep you in compliance, removes a lot of fees and risk, gives us time to comply so that we're not in violation of any of the employer mandates. We can offer coverage appropriately to our staff and that we make sure that it's affordable and that we've done all that testing during appropriate time frames. So that 6-month, 12-month is very critical. So as we kind of consider time frames, I want us to keep that in mind. So last time we were together, we kind of went through that in a nutshell, and you instructed me to go back and ask the final 2 carriers to really sharpen their pencil, make sure they were coming forward with their very best offer, and then go ahead and take a look at some plan options for your consideration and our conversation this evening. What I want to share with you is that the renewal offers that you got consistent with the current plan are absolutely the best that individuals can do. Some of these, this first 6-month guarantee, the Affordable Care Act is demanding new fees, new taxes, some different items that now have to count toward the out-of-pocket maximum that literally wasn't true a couple of months ago. So this is the very best offering that we're likely to get from the market, and quite frankly, both these carriers have been extremely aggressive in their pricing. So I'm actually very pleased to be able to offer what we're going to be able to show you tonight. And in fact, I took the opportunity in the report to remind the board that when I was here basically 20 months ago now, or maybe 21, we were looking at rates that were actually higher than what are being offered now from our renewal opportunity from WEA Trust. So the offering that we're going to be spending the majority of our time on today through the WCA is literally 4% below for the first 12 months where we would have been 2 years ago had we stayed with the WEA Trust. So I'm feeling very confident that we continue to get the very best offering that's available and that we're saving as much possible dollars and being as fiscally responsible as we possibly can be. So I thought that that was important to share with you. So in prior discussions, it's our understanding that the board wanted us to evaluate potential plan changes that could be made to achieve additional savings through the health plan. We've outlined these options for your discussion tonight with the 2 most competitive carriers. And I do want to say, because this is a very strong feeling on my part, both as a consultant who's out in the community a lot, and you'll hear me make these passion pleas before boards and city councils and county boards all over the state, that just because you can make plan changes doesn't necessarily mean you should. So as we look toward what's our very best fiscal outlay, what's our very best strategic plan, I'd ask you to kind of keep that in mind, because we have very strong feelings about healthcare these days. It's on the mind of every person on a daily basis, with all of the discussion around the website not working for the Affordable Care Act, and how personal it is when people are losing healthcare coverage out in the community. So obviously this becomes a very protected subject as we talk through it. So we want to be very rationed, and we want to be very strategic as we move through this report and our opportunities.
But the decisions we make here today are for 18 months.
Correct.
Okay.
Well, yes, potentially. They do not have to be. And thank you for asking that question, because that's a very good point. Right now, because we've asked these carriers to be so competitive with their initial offering, quite frankly, the decrements that are available for the plan design changes are not necessarily where they would be if we were just looking at an average renewal and saying, if we change the deductible, what would we get? We've asked them to compress their pricing so much to get the very best initial offer that we probably are getting less for those plan changes than we would if we made them at a different time. So I think that that's a very good point. I'm not sure if that was the one you were trying to bring to my attention, but it is a very good point.
Well, I was just concerned that if we decide that we're going to keep the plan exactly as it is, that we are with that for 18 months, as opposed to if we make some changes, or are changes allowed 12 months from now?
Literally, changes are allowed in a fully insured plan design any first of the month you'd like to make them, with a 30-day notification. The reality is we're going to be looking at a change on 7/1, and then another change the following 7/1. So anytime you'd want to make a plan change, that there would be additional opportunities, and we would ask the carrier that we're with at that time to consider the repricing of that. So, I think that that's a very good question. We want to make sure that we're careful about this, and we're cautious, because quite frankly, these are very modest increases. The 2.34% that we're going to be looking at for the first 6 months with WCA is actually less than the increase that would be mandated through most of the Obamacare taxes. And I refer to that because the president said it's all right to call it that. But the Affordable Care Act is the taxes and fees typically are right around somewhere between 3 and 5%, depending upon the size of the group. And these are being paid through your fully insured carrier on your behalf. So it's important to kind of keep that in our evaluation. Healthcare is so cyclical, and quite frankly, right now, it's so volatile that the longer we can nail down something and offer surety to as many individuals and as plan participants as we possibly can, obviously that's clearly our recommendation. And lastly, we evaluated the survey results that the district was kind enough to forward to us after we had written the initial report, and found that some of the feelings and the comments that were shared with the board, with anyone who chose to read them, showed how personal and how important this decision is going to be to your staff. I was very pleased to see how many people did take the time to comment and participate in the survey. I think that's unusual, particularly given the fairly quick turnaround time in which that was able to happen. So if the district were to renew on the current plan of benefits, our recommendation is that we consider a change to the WCA Group Health Trust. The savings over the Humana presented renewal for the same period of time is $184,000. Again, it puts us at roughly 4.3% below where we would have been 2 years ago. That, in connection with a change to Delta Dental immediately, is an additional $54,000 worth of savings over what we're currently paying today, and vision remains flat as we had a 4-year rate guarantee for that. So we'd be looking at a savings of approximately $250,000 over where Humana Medical and Dental would keep us as we make that change. So that's our initial recommendation. Obviously, we've given you the plan decrements from both carriers, so we can take a look at that and go through that, but you've seen the recommendations, and now I just would open it up to any questions or comments that you might have back for me.
So it's a savings over what the renewal would be. Do we know what the increase is from where we are, the hard dollar? I mean, we know what's going on.
Yeah, we actually do. Where you are today on on a 12, if I went 12 months and 9 months, and 6, we would roughly have to add about, we'd be at 9.5, and we're going to 9.772. So if we were exactly where we are today for an additional 18 months, we'd be at roughly 9.5 million. So it's slightly less than that, like $11,000 less than that. I'm trying to do quick math in my head. And the recommended change is 9.772698.
So with the plan, the way it's recommended, we're saving 238 over the Humana proposal, but that puts us 272 higher than where we are right now in real dollars.
Correct. This, those 2 renewal periods though, Mr. Nielsen, do encompass actually 3 fiscal years because of the 18 months and the 18 months. So we've accomplished that little bit of growth, and the 272,000 is actually still less than what we would have been paying.
Right.
So, I mean, it's, when you start to measure it over a 36-month period, it's a lot less of a percentage.
I was looking at the options that you laid out that could reduce our costs by changing the network deductibles and the non-network deductibles, option number 1. And as I read through those and I compared them to the insurance that we have where I'm at right now, and I am on the committee that purchases the benefits there at the company, these options are still substantially below the plan that we have, and our insurance carrier tells me that we have a very rich plan and that we should make changes and have higher deductibles and things like that. It turns out that although he calls it a very rich plan, it's only a silver rated plan. So it's not that rich. But our deductibles and co-pays are just substantially higher. And if I were looking at this and at the options that I would recommend that we would consider, option 1, to move to the $250, $500 in-network deductible and the $500, $1,000 non-network deductible. It wouldn't go as high as option 2. Option 3, the co-pays to $10 network, $25 non-network, $25 urgent care, and $100 emergency room. I didn't think that one was all that bad. Option 4, where the emergency room went up to $150. That's something we talked about in our plans too, and I said I don't like that one. If you're going to the emergency room, somebody's hurt, you're not thinking about what is this going to cost. You're thinking about caring for the individual who's hurt. So I wouldn't want to stick them more. They have enough problems at that point. And then the option 6, the change in the prescription co-pays. I thought that one was reasonable also. The elimination of the waiver premium, someone wrote in their write-up that they didn't think that was right. You know, they're struggling enough. And another comment was about alternative medication or alternative medicine. That's the word I couldn't come up with. Like chiropractic or acupuncture. Do we have much in that line? Where's our coverage on that?
Well, let me go through both of those because I think it's important that we understand what we're talking about. Because a number of comments as I read through the survey results were, I don't understand waiver of premium, or I feel very strongly about that, and people wanted to protect something, particularly if they didn't feel strongly that they understood it. Waiver of premium is not a function of I get to choose it, or the district gets to choose it. If someone is found to be Social Security disabled prior to going out on disability, and it's only the employee in this case, their family gets the benefit of that challenge to their family, but if the employee goes out and they're found to be Social Security disabled, the carrier at this point in time picks up their premium for a maximum of 30 months. The 30 months is not magical. What happens is if I am Social Security disabled by some kind of medical condition, at 29 months, Medicare kicks in. So I go from a group health plan on to Medicare, and it's due to disability, not due to age. So the 30 months is not a magic number. So if I go out, for example, if I were having a high-risk pregnancy, and I was out on a disability, I would not be eligible for waiver of premium. So I have to be determined by Social Security to be totally disabled to become eligible for waiver. Some more serious medical conditions, that might happen. And it's a carrier decision. So Social Security is involved. So it's not just anybody that leaves the district due to a medical condition gets waiver of premium. And I think that's been a little bit of a misnomer. Also, the misnomer is that the district gets to decide. That is not the case. This was something that WEA offered that was never a negotiated benefit, but they offered because they had trust dollars to put toward this benefit. Humana agreed to continue it. WCA will agree to continue it. At present, we have no one that's on it. We have had in the past since I've been involved with the district. So I don't want to say it's never been used, but right now there's no one on it. So that benefit, I just wanted to explain it and get it on the record because there's a lot of different ideas and questions about it. With regard to chiropractic coverage, chiropractic is covered pretty much as any other illness. Where the challenge begins for everybody, and this is true of every insurance carrier that I've ever been working with in my 25 years in this business, people think maintenance is medically necessary. My husband, for example, likes to go to the chiropractor once every 3 weeks. We pay $40 for an adjustment. He feels better, and I'm guessing it works for him. I'm not a chiropractic user. So but that is not a covered benefit because it's considered maintenance care. It's not improving a condition, it's maintenance. I'm guessing that's what people are referring to, particularly when they start talking about acupuncture. It's pain medication, it relaxes the system. There's a lot of good things around all of this. Very few carriers cover it unless there's some kind of reason for biofeedback, sometimes with certain cancers. Certain pain management techniques, acupuncture or biofeedback might be a covered expense, but it's pretty rare to have a carrier cover it, and it's usually on an exception basis. So if I'm hurt or sick and chiropractic is found to help me, all of those treatments are covered, but there's usually a pre-treatment plan or authorization. Usually a car accident, simple fender bender, not that they're always very simple, but usually for a simple whiplash where you weren't really seriously hurt, you're gonna find that you get between 8 and 12 visits are gonna be pretty standard. You can whip through those in pretty quick time frame if you go every time your chiropractor recommends it. So I get where people would like more, but we have better than standard coverage.
So with what you just talked about with the waiver of premium, I don't know how often we've had to tap into that. Would there be a recommendation from the Horn Group that we could save this $49,000 and maybe go, well, if we did have somebody who was in that situation, we could almost, in this instance, I'm just talking out loud here, almost self-insure to say we'll just have a policy in place that that's covered, would we come out ahead, or is that not something we would go with?
You know, honestly, a lot of districts have taken that tact. I don't have any issues or problems with that. I think the thought behind what what the concern was in the survey is that people feel that those, if they understood it, they feel that those that are in that position are already struggling enough, and let's not make them pay COBRA premiums or continuation premiums. I think it's worth saving the $50,000 and self-administering it if you chose to, for those unique situations that come up. You're reducing your premium. I think if that's a district, I could certainly get behind that and would strategically argue for it, because you're going to reduce that premium by that 0.5% each and every year forever. But I would think that I understand the consideration for those individuals in that hardship circumstance, because it's not like they chose to go out. This is not a, I'm going to milk it for all it's worth. Social Security's getting involved, and it's a pretty deep deal.
Well, and it's a known quantity. And
correct.
So every year that ticks by that we don't have a situation like that, and of course we hope no one is ever in a situation like that. That's another $50,000 that we're ahead of the game.
I can strongly recommend that and get behind it.
Well, we heard what Horton recommends. I'd like to hear what the administration recommends.
Well, our recommendation, Jim and Judy have been probably a little more intimate in this than I, We believe that the plan as it is in place right now is a good plan for us. You will always have increases in anything. We don't think it's a Cadillac plan, and we believe that the plan that's in place right now is mainly, as it was depicted in the survey, is something that is important to our staff, and we think that's an important component of everything we do in our district, is making sure that our staff is feeling good about where we're at. The other part of this is in our conversations with Rayanne and Jim and Judy and myself, there's going to come a time in the future, I think, and I don't have that crystal ball, where we're going to have rates that are much higher. And to your question, can we change at any point in time? That always makes me really nervous, because at a point in time they could be much higher than what we've even anticipated, and I think that's a dangerous gamble to take. But I think there will come a point in time where we have the opportunity to buy down, if you will, by whether it was a waiver of premium is one thing, or the deductibles or whatever it might be. I believe it's our belief, and you guys correct me if I'm wrong, that that's the time to invoke those kinds of things. Because I think right now we saved $1 million last year. We've got, I don't know what I didn't do the calculation between the savings and the increase and so on, so I don't know what that dollar amount is. But it's, whatever it is, I don't think it justifies, from our standpoint, from a staffing standpoint, the need to make changes at this time.
1% of your annual premium is roughly $60,000. So it's going up about 4% over the last 36 months.
Jim, would you add anything? Or correct me if I'm wrong, too.
No, I would agree with that and echo your sentiments. I think when we get to the point, and it may not be far away, it could be the next time we go to market, that maybe we're looking at a 9% increase or an 11% increase, and we're thinking, okay, well that's high. How are we going to work around that? And if we've already made a number of these adjustments, taken these options, now we're really cutting into the plan. We're getting into very new territory on undoing these benefits. It seems like when we have a premium increase that's fairly low, it's certainly less than we've budgeted. And it's great to see. I think it's just wonderful at this point that we can still get this kind of attention from the market and get rates that are this low. We go with that. I would say the things on this sheet are certainly in our future at some point, but it would be nice to be able to pull them off and use them when we need them, to take that 9 down to a 6% increase or something like that when we're in a bad spot and we need to have that, rather than using them now when we already have a low increase.
Go ahead.
I would say that the time to save the money is when you can save the money. And some of these options that are thrown out there are not only to reduce the premiums, but if you have no copay at all when you go see the doctor, there are people who go to the doctor whenever they have the slightest sniffle. Some of it is to reduce people going unnecessarily. You know, if you're sick, yes, go to the doctor, but if you can reduce the usage, you can lower your overall costs of the plan and get even a better quote next time. Instead of 11% increase, you may not get anywhere near that because the plan isn't being used as extensively. So that's why you do some of these things, not just the premium reduction, but to reduce the usage.
Right, yeah, I guess looking at a $10 charge for going to the doctor, I don't think that will turn anybody back who feels that they need to go to the doctor. We're also in a situation where we have 300 teachers who are all with a ton of kids every day who bring a lot of illnesses to school. So it's a little different than the workplace. We do see teachers getting ill more often from that, and some of them tough it out, and some of them do need to go to the doctor. So I think it's a little bit different in that way, in that we need to make sure that they're covered or they're not. They're going when they need to, kind of a thing.
Yes, but if the $10 isn't going to prevent them from going, then obviously it's not a significant burden either. So to change the copay should not be a big deal.
Well, I think anytime you talk about anybody making a monetary contribution out of their pocket is a big deal to our staff. And I think our staff, as we look at just the data, that the number of staff that we had absent, so on and so forth, it's pretty positive in terms of we don't have a lot of people that have used the plan in any way. But when you talk about anybody taking anything out of pocket, whether it's you or I or anybody else, it is a big deal in this day and age. Anytime you have money that's you have to put out for anything, whether it's bread, gasoline, whatever it might be, it's important. You know, when gas goes up to $4 a gallon, I'm not too happy either. And there are people out there making billions off of it. So I would argue with you, not argue with you, I would just say that for our staff, they do consider it a big deal.
And I don't disagree with you. We are making decisions that we are putting our hands in their pocketbooks and pulling money out. I mean, I understand that. But I'm looking at it from what does the rest of the world have? How are we all living? And what is the fair thing to do? And I just think some of these changes should be made.
If I can just share my perspective as the Human Resources Director for this district, it's my job to hire the best people, and when we get them here, to retain them. And this is a significant factor in that equation. And post-Act 10, we are seeing more people moving around as a result of changes in benefits and their compensation. And I agree with Dr. Patz and Mr. Milzer that we need to wait to make these changes so that our plan is one of the better plans for as long as it can possibly be, so that we can continue to attract and retain the very best employees, because that's what's fair for this community. That's the right thing to do for this community, is to have the best education for the children.
Randy, could you speak a little bit to, last time you were in, you mentioned how our loss runs were and the health of the group, and I thought I remember you saying that they were running high.
Mm-hmm.
But then tonight you said that, you know, and it's great to see all the competition, and that we have a healthy group and that they want to compete for our business. Those two didn't seem congruent.
and I certainly understand that. Your loss ratios are running in roughly the mid-90th percent range. What that means is that for every dollar that the carrier takes in, they're paying out 95 cents in claims. And they've been escalating, quite frankly, since, you know, we pretty much started with Humana. So there's probably some of that has to do with the season and the time of the year that certain things have hit and occurred, because we went to an 18-month cycle versus a 12-month cycle, and we weren't getting a lot of really good data out of WEA. What I'm trying to share with you now is that because you're still a fair group, and the two that we know came forward with their best practices. First of all, the WCA Trust, the plan I'm recommending that you go to, they have a very, very small, much like WEA, window of administrative costs. So they can still make money at 95 cents going out in every claim. So they brought down, they were as strategic and as fiscally responsive to our RFP as they potentially could be on the current plan. I would share with Mr. Alexandrovich, and I hope I didn't slaughter that too badly, that, you know, while I understand the need or the desire in some cases to want to make these changes, I strongly believe that if we give it a little bit of time, whether that amount of time is a year, whether it's 6 months when we get to our next fiscal year, or whether we take the whole 18 months as is being recommended here, quite frankly, these changes will be worth more in the future than they are right now. We got very little from the market to make these additional changes because they had struck down their fees so tight in the first place. The challenge becomes, as you go along, not only, you know, we can argue and debate and discuss utilization patterns all day long and what changes people to do the right thing and what challenges them to wait and not go and do the right thing. We can do that all day long, but the reality is what we're looking at today is we're looking at 2010 pricing for a 2014 plan with some additional costs that the market is going to bear. And the fact remains that people are going to get done anything they potentially can, given what's happening in the world of healthcare. If I'm leaving the district or I'm thinking about retiring, I'm going to make sure that I get things taken care of. So the outside forces that are coming in here right now play a big part in what can be offered in terms of increases and decreases for plan changes. The other thing that I would share with you guys, because I think it's important for your consideration, is we're not the private sector. I work predominantly in the public sector market. I have clients all over the state that have gone to $2,000 and $4,000 deductibles, and you know what? Next year they get a 20% rate increase on a lower starting point, and they've got no place left to go. So I want this district to have maximum choices every time that I'm before you. And I want to be able to offer those choices very passionately and vehemently. I'm a taxpayer too. And honestly, I agree with all of the sentiments that are expressed here today. I want to do it, but I want to make those changes when they're strategic and fiscally prudent, and I think that's important.
How often will we review this to know when it's the right time?
You can have me come back in here whenever you'd like me to.
No, but I'm
saying,
you're the expert, so
right.
you would know.
Honestly, if I had my druthers tonight, my recommendation would be we leave it alone for as long as we possibly can, because we've got a really nice rate guarantee. If you want to review this again for your July date or next January, we absolutely should do that. If we can take a look at how things are running, are our loss ratios going down? Are they staying consistent? Have we gotten excited about some wellness initiatives through the district? We're getting a wellness grant through WCA of approximately $15,000 to do what the district wants to do with that money, with, whether it's flu shots or flu clinics or walking programs and prizes. We have the opportunity to do that. So I think we want to ask people to get engaged and be a little bit more responsible for their own health, because otherwise, you know what? The plan's going to change, and it's not going to be some of the modest things you've talked about tonight. And I feel very, very strongly that we give people the opportunity to react. And as long as they bother to take the survey, I'm going to take their feelings into consideration, and I'm going to argue for that. I think it's important.
I know from my perspective, that is one of the biggest adjustments that I had, is that I do work in the private sector, and this isn't the private sector. And when I saw some of the benefits package that's laid out, and I compared it to what I'm looking at, it was a little bit of a disconnect. So when that came in, and trepidation, I was with the staff thinking that the board was going to start making all these changes and not take anybody into consideration. I think we did a pretty good job of navigating the benefit package last time. We took the administration's recommendation. We had chances to make changes, but why would we make changes when we're saving $1.2 million? So I said, okay, well, when we come in this time, I'm sure this is the time where we're going to end up having to play those cards. We're going to have to try and do something to keep our budget in line. And then the proposal that we get, excuse me, is an overall increase. But I do understand where you're coming from. We really didn't get the maximum bang for our buck. And first of all, I would say that the waiver of premium is something that I think the board should strongly consider eliminating. And if we have to put in something in place as a safety net on an individual basis, I think that's something that could be done so people have peace of mind, knowing they're not going to have to worry about paying those premiums, because this would be money that we're going to save every year regardless. So that's
let's also remember the $54,000 on dental. That's just
correct. Correct. But I do want to make a comment, and I would like, understanding that we're all in this together, I would like to have people come to the middle on this one and really understand that this is a Cadillac plan. A $0 $0 office visit copay is a really great plan. And I don't have to be jealous about it. I don't have to be resentful for it. But it would be really nice, and it's just me talking, to hear from the other side of the table that we recognize that. And that is a good plan, and we want to have good employees, and we want you to be able to retain, we want you to be able to hire. So when we keep getting beat up that all we're doing is trying to not do right by the staff, other words I was going to use, but that isn't the case. This is a good plan. A $25 emergency room charge or a $100 deductible, this is a really good plan. And so I think if the board, this is a possible action item. It's not necessarily an action item tonight, and then we need to consider this. But I don't know that the savings that we get now, certainly there are savings. We're talking over $250,000 on it, moving up to a $250 network deductible and a $10 copay. Those are real dollars. And that's just a decision we're going to have to look at and have to make. But I was all prepared to figure we're gonna have to make some of these changes, and now looking at how this stuff is coming out, I don't know. But I would really like people to recognize in this district that this is a nice plan, and to just say, thanks, because it's good.
And I think, first of all, you know, I think I'll promote it and say it again for the staff, because I thought it came out pretty clearly in the survey comments. I think they were pretty pleased and thought that it was important to them.
Somewhere. And you're always gonna have the other side.
Right. But many were, and you know, I guess it's a possible action item. I would say to you that we don't have a lot of time. If we are gonna make a carrier change, the staff will need that training. We need time to get ID cards generated, and you know, we're looking at January 1, so we've got some holidays in here, we've got some other things that have to be taken into consideration. So I understand that you may want additional time to evaluate, but I would strongly urge you that by the next time you come together, we have a firm decision on whether or not we're going to move forward, because it is getting to crunch time.
Well, let me say, I am in the government sector, and I don't have this kind of a plan. You know, I'm looking at $300 or $900 deductibles, and this year a change in cost share, 5% increase in cost share, and there's not going to be a 5% or a 2% increase in salaries. So I think that we have to look at making some changes. To your point that we need some options out there. We could do one and not do two, so there still leaves an option that if we need to in the future look at higher costs. We still have that other options that we can take. So we're not going all out and making the most extreme changes here, but we can nudge a little bit on some of these items. I think your point of uncertainty is very real, which leads me to believe that we should take the savings that you have that are in front of us because of the uncertainty going forward, not only in the whole insurance market, but state aids and future funding, school funding is uncertain. So I think we need to be very serious about making these changes at this time. I don't think they're unreasonable, and I think we should seriously consider doing some of these. And as Alan recommended, the first step with the $250 and $500, I think that's very reasonable. I think the copay is reasonable, and something on the prescriptions. I don't think that it's unreasonable.
I'd like to say that I work in a neighboring district, and 2 years ago, we went from a plan just like this with a $200 deductible for family to $1,000 deductible, and we have co-pays and we have co-insurance, and we didn't get a survey, and I'm not happy about it. I haven't been happy about it. It takes, by the time you reach your deductible, it's time to start all over again. And would I want to put a $1,000 deductible on you? No. I think the deductible should be raised. That's my opinion, but not to $1,000. Not now. A jump like that really hurt. It did hurt because there are people in the district that don't use insurance, but there are some that are really ill and do use insurance. And I do think we need to make some changes though. But as far as people leaving, in the district I work in, I didn't see people leave because of insurance. You know, we always talk about the climate here. I think we do have a good climate here. Other districts don't. And you know, taking a survey and listening to you, other districts don't do that. We have to make some changes, but they don't have to be drastic.
Ray, what is the drop dead date? When is enough's enough and a decision has absolutely can't go any further?
If I looked at your calendar correctly, you have your next meeting is November 6th.
Right.
It can't go beyond that. I mean, it honestly, it takes a good 6 weeks to implement something properly and with all the things that are gonna be going on as I think about school. And maybe I haven't been in school in a while, so the calendar may have changed, but the reality is we're coming up on some fall breaks and some times off that just are not gonna be conducive if we need to get information from the folks that work here. So that really is the drop dead. You know, if there needs to be time to consider it, I would certainly, I certainly understand that. This is a lot of information, and again, we're digesting an awful lot, but we can't go beyond the next meeting.
Dr. Katz is suggesting we have an ad hoc committee.
Well, I think it's worthy based on the sentiments we're hearing from the board and those that you've heard from the administration talk, that I think it'd be worth our time to sit down and say, okay, let's, as Tim said, come to some sort of midpoint or whatever it might be on some of these things, or at least have a little more intimate discussion on them, and then bring that back on November 6th for a final vote. That would be my suggestion to the board.
I know in the survey there was a question about increased employee premium share. I really don't hear any discussion about that. I don't know that I really want to go there. You know, that wasn't something they were excited about. There were comments about if there's changes that need to be made. And this would kind of get to where I was talking about the loss runs, which isn't to imply that they're using the insurance haphazardly, but you know, some changes in deductible or changes in copay may lead to behavioral changes, which may lead to overall lowering of claims, and that's a supposition. But so I think if there were any changes to be made, they would probably be something along the lines of what you proposed here, rather than a premium share.
I'm not opposed to having a quick committee if that's what
We could pull that together early part of next week. And if the board wishes to do that, we'd be more than happy to entertain that. I think it would be worthwhile for us.
I haven't been on a committee, so I would like to be on that committee. Is there anyone else who would like to volunteer to be on the committee? We only want 2 people, 2 board members. Are you? Okay, Alan? All right.
Why do we have to have 2 board members? I'm just curious, because last.
Well, I
committee
guess we
had
could have 3.
I'd like to be on that committee.
All right, that's fine.
So you Alan and Debbie?
Are you gonna be able, we have to meet quickly, so, because it's the 6th, so.
Yeah, we'll get something up to you real quick.
All right.
Something that might be, I don't know if you can throw something out to kind of query the staff one more time, but if we were looking at making a change, and if we were to make all these changes, what would a preference be? A deductible increase if we're going there, or a $10 copay?
Well, that's kind of what this chart shows. It took me a while to realize that the left or the top. The shortest bar is the most popular.
So the
The
$10
tallest bars are
copay.
the least popular.
Rated more palatable than an increase in deductible.
Yeah, and I definitely think that if, you know, the committee is considering any changes, they need to take into consideration the feedback that we got from the employees.
So that $10 copay would be a 98 roughly, almost 100, and then another 50. That would be $150 in savings to the district for adding a $10 copay for when they go to the office. One way of going. So,
I'll get dates over to you. That's okay with you, Brian?
Mm-hmm.
Or do you want me to contact you?
Yeah, that's fine.
Any other comments or questions? All right, thank you.
Thank you so much.
All right. Item 9D is our inroads presentation.
I'd like to introduce Terry Testman to all of you. We brought Terry in this year, and first I'm going to have Mike Nowak and Nick Cohen come up and do part of these little background before Terry begins her presentation. We're really excited to have Terry here. She brings with us something that the board I know has discussed, not a great deal, but in terms of building partnerships and getting more exposure and experiences for our kids. So, Mike, I'd ask that you give the board an overview of what we did by bringing Terry on board, and we can speak to that, and we'll let Terry sort of run.
Thank you. Good evening. I know last year you heard Nick and I talk about our efforts towards personalized learning, and in particular our vision for an Inroads program. That's evolved quite a bit. We've had an awful lot of discussion with people in the community, with you, with teachers, with students, with parents, about interest in moving forward in this direction, and that's led us to bringing Terry in with us. Terry Tessman comes to us from Middleton. She serves as our Inroads coordinator for half of her schedule, and then she works as a Project Lead the Way teacher, both in engineering courses and in a computer course, which she'll speak about. We have her here tonight to share with you a little more of our vision moving forward. We hope that you enjoy it and ask questions, obviously, but we're thrilled to have her.
Thank you, Mike. I'm going to stand because I feel uncomfortable with my back being full, so I guess either way I'm going to. My name is Carrie Tessman, like Mike said, and I had two goals to come here tonight. I'm not going to get into all the details. What I really want to do is to give you a sense of who I am and why I was brought in here, but also because I'm going to start being more involved in the community, I wanted to make sure you guys had the professional courtesy that if somebody came up and started talking about this program, they had some knowledge about it, a little bit more than what has been created so far, because we have made some significant strides. Again, I'm not going to get into the details. I will be talking about the courses that we are going to add at the November 13th, thank you, the November 13th course description. But I'll try to be succinct. If you guys have questions, please feel free. And I'm gonna, like I said, talk a little bit about myself. I was a biomedical engineer, and I loved my job. It was a phenomenal job. I did some really neat things. I worked on an artificial bladder with the Mayo Clinic. I worked for Bristol Myers Squibb, and I worked on bioabsorbable materials. If you are older than dirt like myself, you remember when Jessica fell down that well in Texas. This little girl was out playing in her backyard, fell down a well in Texas, and was trapped there. And it pretty much the whole nation kind of was praying and hoping. And when they brought baby Jessica out, she was alive, but she had laid up against the shaft in the well for close to 3 days, and the skin on her forehead had died. I was traveling for business at the time, but they had called and asked if one of the things that I was working on was a self-absorbing tissue expander, and they wanted one sent. So something I had worked on went down and was actually implanted in baby Jessica. So that's the kind of stuff that I did. It was wonderful. I loved it. But I had 3 young kids at home, and I was traveling. And if you know anything, I know you're involved with a regulatory agency with your dental business. But one of the things when you do clinicals, and I was a project engineer and a design engineer, I did created a lot of devices. I'd have to go and travel a lot. So I would be in Europe. I'd leave on Sunday. I'd lay out, outfits for my 3 kids. My husband was really good at doing hair, but he was really not very good about coordinating outfits. But I was traveling a lot. And one night I called home. I was down at New Orleans at the AUA with some physicians, and I asked my husband, I said, how'd it go? And he goes, we just got home from the emergency room. And my younger daughter had to go along. I usually took my older daughter to soccer practice. My younger daughter, who was 3, was climbing the monkey bars, fell down and fractured her skull. And Mom was in New Orleans. So I was really struggling because I wanted to be a mom, but I loved my job. Well, my kids were going to the Prairie School in Racine, and I'd go in there whenever I could for career day, and they had called in a couple weeks after this happened and said, you have a big network. Do you know anybody that would create to come in and articulate and really get our science program vibrant? And I said, how about me? And they started laughing. And they said, you're overqualified. And I said, I'm serious. So I took a $120,000 a year pay cut and went and worked at the Prairie School. And I taught teachers how to do computers, and I articulated their science program from 3-year-old kindergarten up to high school. I, evolved into digital productions, and I really liked that. I was teaching Final Cut Pro, I was teaching Adobe Photoshop, I was working with a scientist from NASA. He came in and we did Mars programming using a Kipper system with the high school kids. It was pretty neat, but Greendale, over yonder, called and said, would you start a digital productions department here? We've got a cement floor, a couple broken computers. We've heard good things, so you come on up. So I went up and started working at Greendale. So you know how kids get into things, and they were Googling me one day and they said, you got patents? And it's like, yeah, I do. Well, why aren't you working in the engineering program? And I said, what is that? I had no clue. And that's how I got involved in Project Lead the Way. So pretty soon I started working in their engineering program, and I was down at the University of Chicago, and I was doing a training, and a lady came in from Project Lead the Way, and they were starting a biomedical program. I don't know how much you know about Project Lead the Way. Project Lead the Way is a hands-on project-based course, obviously, and they had started in 1990 by an engineer who felt that kids were not prepared for the real world, and they didn't even know what engineering was. And I can relate to that, because when I graduated from high school, I thought an engineer was the guy that pulled the horn on a train. And I had no clue there was something like an engineer. And over time, when I started working at Bristol Myers, and I was doing biomaterial research, it was like, I want to do that. So I went back to school, and that's how I became an engineer. So at any rate, I went down, and when I was doing all these Project Lead the Way things, I became more and more impressed with it. The kids were discovering things about themselves that they had no clue. It's a different way of teaching, but what it does is it teaches the kids to be responsible, and they become the teacher. And I was just the facilitator. So they say, how do you do this? And it's like, well, what have you tried? Not, you need to do this. There is no spit and get. It's not memorization. It's learning how to think for yourself. And that's why I really like Project Lead the Way. So I'm down at the University of Chicago, and they have decided Project Lead the Way, which is a national organization. It's affiliated with Duke, Northwestern, Purdue, Rochester Institute of Technology. This is across the United States. It's in all 50 of the United States. The kids get 3 college credits. So when you start talking about financing, you pay $65 to get 3 college credits for each of your classes at MSOE. When my son was in college 5 years ago down at Parkside, he took a 3-credit college summer class. It was $1,400. This is $65, and they get articulated credit. I had one young man graduate from Greendale that I had. He graduated with 24 college credits. And it sets him aside from other kids, but most importantly, he knew what he wanted to do. So when I was at the University of Chicago, they were starting the medical program, and Dr. Carolyn Maelstrom was there, and she goes, would you be interested in doing this? We don't have anybody outside the 7 states that started it. And I said, how do I do it? And she goes, you start calling on October 15th. So I'm over at Greendale, and I'm calling Kim Midzik every day. Did you call yet? Did you call yet? And so they did call, and Greendale was one of 2 Wisconsin high schools that got in. And within 2 years, we were one of the top 7 schools in the country. Project Lead the Way paid for myself, Steve Lotus, and 4 kids to fly down to Austin. We presented at a national organization. So the kids got up there, and they're showing the people how to do laparoscopic cholecystectomies. How do you do memorization stuff? It's all hands-on, and the kids just like this stuff, and they're really learning. So what happened then is people were starting to come in and seeing the program. So twice a week, they'd have people come in from other school districts, and the kids were really, the kids could talk about what they're doing. The kids became very proficient, and they became very good at presenting, and they became very professional. And 14 months after that, 2 years ago, I was grading finals in June, and Dr. Don Johnson from Middleton called me up, and he said, we're looking for somebody to coordinate our Global Academy, which is 7 different schools in the Madison area, including Madison, Middleton, Verona, McFarland, Belleville. So he said, will you come work up here? Ever since we were there, a year and a half ago, we wanted to get you here. And it's like, well, I live in Racine. Yeah, but just come talk to us. Well, 2 months later, I was up at Middleton starting this program. The thing that's important is that this program sells itself. The kids like it. The kids talk about it. When I started at Middleton, because that's where I was the homeschool I started, 2 years ago at this time, we had 18 kids. When I left, 18 months later, there was over 350 kids enrolled in the program. I went over to Verona High School and talked to their 8th grade parents. And their 8th grade parents, we had afterwards, they went to all the different things, and one of the parents said, you have to start this program here. And I said, well, you have to talk with your superintendent. He said, you see all those other booths, there's nobody there. This is where the future is for our kids. So I started with 20 kids there, and when I left there was over 100 kids there. I had kids from Belleville come, kids from Madison School District come into that program. The thing is that I live in Racine. I go up on a Sunday in the afternoon, I rent a room, work there, and on Friday night I would go home. And I became homesick. So last year I was talking with Wendy, who I'd worked with at Greendale, and I had told her that I was interested in coming home. And she said, would you be interested in coming to Franklin? So that's how I ended up here. I am older than dirt, so I have had a lot of experience with this. I do know that it's really, really important to expose kids to things that they buy into. This is a great program because they become responsible for their learning. I am not somebody that puts information in their head. They are somebody that generates and learns how to think. The important thing with this is kids who take Project Lead the Way classes, MSOE will give you the statistics. They have looked at the kids that have gone to school there, that have taken Project Lead the Way classes, and kids that come into their program majoring in engineering who have not. The kids who have not majored or have not taken Project Lead the Way class, only 47% of them stay in the major that they thought that they want to when they stay in engineering. Of the Project Lead the Way kids, close to 98% do. Now, I don't know about you, but it is really expensive to be making explorations in college. The other thing is they find that the kids that take Project Lead the Way classes, because they know how to think, they get a half grade point higher than their peers. That's pretty substantial about the success of the program. So I don't talk about myself a lot. I'm not real comfortable with it, but I think it's important. I'd like you to think when I leave here that you've hired the right person to do this. I do have a lot of contacts across the country. I am a master teacher for Project Lead the Way. I teach the 3rd and the 4th year of the program. They asked me to come in and write the curriculum. I helped write the curriculum for the 3rd and 4th year of the program. I work on their national assessments for college credit, and I have done that for the last couple of years. They asked me to come in and start the biotechnical engineering rewrite, so I worked on that curriculum. I've advised them on their learning management system, which is a comparable thing to the Moodle. The other thing is, last year they decided they were going to add a computer science track. And they had over 400 schools apply for that, and I applied at Middleton, and Middleton was accepted. When I left Middleton, that program stayed there, but they only picked 60 schools across the country for this. Franklin had applied and was denied. When I came down here, I called the guy and I said, I asked Mr. Nowak, I said, would you be interested in doing this? And he said, yeah. So I called him up and he said, yeah, we want you to pilot this. So you are now piloting this at this school. You're one of 60 across the nation that have been granted this. They have found that that's such a good class, they're going to expand that pathway to 4 additional classes starting in a couple years. And I've been asked to help write that curriculum, which I'm probably not going to do because I do like to sleep at night. This is something I have been talking with a lot of the people that are the movers and shakers in the industry. The things that keep coming back is that the community is so important, but one of the people I talked with was Brent Kindred, who was in charge of career and tech ed up at Wisconsin DPI. I think this quote is really, really important. College is the most expensive career exploration you can have. And I think that speaks to what the Inroads program is. The Inroads program is modeled so that kids can pick a pathway. It is not a track, it's a pathway. I think when people start talking about personalized learning, they think, okay, this kid, this student wants to do something in medical, so you put them in this pathway and that's where they're at. It's not personalized learning, it's personalizing learning. All of the studies have said that the thing that's most important for children's successes and student success is their relationship with their teachers. It is important as a teacher that you become to establish relationships with your kids. You learn what goes on with them. They become so that they start becoming more aware of themselves. But it's a constant changing thing. In engineering, if something doesn't change, it's called static. And something, you take a class in statics if you've ever been an engineer, and people will tell you that when you get to the one that moves, which is called dynamics, that's where they start pulling their hair out. personalizing learning is a dynamic process. It is not static. The kids in the En-ROADS program are not going to be thrown in biomedical and that's where they're going to stay. They're not going to be thrown in engineering and that's where they're going to stay. Within their path, and I'll get to that in a little bit, I think the important things is that En-ROADS is designed to have career exploration for these kids so that when they get out of high school, they don't know that an engineer is not the person that pulls the whistle on the train. So when we go to the 8th grade kids, and I'm going to start talking with the middle school parents, I have two meet and greet sessions scheduled in December. In November, I'm going to meet with their staff. What are they going to be enrolling in? Basically, we are starting with 3 of the personalized learning paths, which I'll get in a minute, but they're going to take a minimum of 3 courses within that, and then they're going to explore things within that area, but they're also going to be able to explore anywhere along the pathway. It kind of follows the Washington University model, where they get kids coming out with 3 or 4 different majors, because they do not tell the kids, you have to do this, this, and this. They let the kids explore and decide what they are interested in doing. And that's how you end up with possibly somebody that likes art and likes medicine becomes a medical illustrator. So that is why that kind of things are important. All of the kids will have a coach or mentor within, with the other pathway students. They will each take at least one self-paced blended learning center or blended learning class where they'll meet with the teacher during one part of their rotation and then they'll be responsible for their own learning the other days. This is something that the people at, when I talked with the people at the state, when I talked with other people and community business leaders, the fact that we're going to offer or have them take an entrepreneur class, everything in Wisconsin is based around the careers, and this is creating new jobs. Okay, and that's the one thing that everybody has talked to. Brian Albrecht, who is like one of the most well sought out board members in the country, and actually worldwide, he's on over 50 boards. This man is brilliant. He had said, you know what, the community is the most important thing you can do, and you're going to have some kids that are going to work in Shanghai, or they might go work in India, but predominantly most of your kids are going to be in that area or in Wisconsin, and you want to grow your community. They will have pathway-focused instruction. There's going to be required community experiences. One of the things to help grow the community is a maker lab, and I'll talk with you more about that as time goes on, just for the benefit of saving some time. And all the kids are going to be doing a service learning project. That's not going out and doing something in the community like planting trees. It's going out and working with other people to help people and using their learning to do that. Something kind of what Mr. Devlik is doing right now, but also in the different areas. The pathways we are going to add next year are the biomedical sciences. The pathway to engineering, a lot of that's established now, but we are going to add the capstone class, and we are going to add again an international business and marketing. We took those programs because if you look at that STEM handout that I put out there, the Navigator, if you look at it, the 20 top growing careers in Wisconsin are in the biomedical sciences, engineering, or the computer track. And if you look at international business, $80 billion in manufacturing is done annually in Wisconsin. That's pretty significant. And it employs lots and lots and lots of people. Franklin is part of the Wisconsin community, so that's why we're doing that. Computer sciences and applications, we're going to add the following year. The arts, which will include things like what Gail Clark is doing quite successfully, but also some of the other arts. And then service industries, the law, and education. So those are the 3 pathways that will be added the following year. Biomedical sciences, again, I'm not going to get into this. These are some of the kids that I've had in the past, some of the work that they're doing. Kids do right there, he's doing a culture and sensitivity on bacteria. The kids are doing ELISA testing there. If you've heard about MRSAs and superbugs, the kids are actually taking bacteria and creating proteins. They're taking plasmids and inserting them into bacteria and making them antibiotic resistant. This is cutting edge technology that these kids are going to be doing. In the lower right hand corner, those kids are figuring out all on their own. I give them some stuff and say, how does the heart work? And they're figuring that out. There's dissecting. They learn how to read EKGs. They learn what happens when you do a design of experiment. They are doing this kind of things every day. This is in engineering. Again, there's going to be some courses, and I'm not going to get into a whole lot. International business and marketing, again, they're going to have a couple base courses, and then they're going to have a capstone project, and the rest is going to be exploration. We are going to add things like nanotechnology. genetic engineering. One of the things that is going to impact those kids that we have in our community right now are similar to what computers did to me. I started out on a slide rule. These kids are going to be doing genetic engineering. You know there's one base pair difference now on the genetic code that makes a difference between somebody having a normal red blood cell and having sickle cell. These kids know what personalized medicine is. They know that if you can target where the BRCA gene is, they do BRCA gene studies. They know that if you can somehow personalize medicine to take something in a nanotechnology environment and go to that DNA and change that one base pair, that maybe they won't be going to see their grandma in the hospital dying of BRCA gene breast cancer. These kids are very much aware of that. That's the kind of stuff we could offer these kids. The young man on the left was a student I had last year. We went to MATC in Madison, and they actually were working on stem cells. I've been asked to work on with biomolecular modeling on some models which are part of the next gen science standards that our kids will be doing. The young man in the lower right hand corner was at the newborn testing lab in Madison. The man was super impressed. Our kids there knew what ELISA testing was. The kids that are going to Franklin will know that next year. Some of the things that are real important are maker labs. This is something where the community's involved and you're getting the experts and the things from the community that are going to come in and work with the kids. We're going to use a lot of the stuff that we already have, such as the 3D printers and the lasers that the district has supported. iGEMS is a program that has to do with biomolecular and genetic engineering. Service learning, this is real important for the kids. They learn a lot. If you look in the one on the right hand, this is my biomedical classes last year. They had a service learning component. They had 100 second graders pull up. They had these kids extracting DNA. I didn't do this. These kids did. They had second graders extracting DNA from strawberries. They were teaching what happens when their heart rate went up. So they'd have them do some exercise. Those kids are learning what their pulse rate is. On the left, these were some of my engineering kids. What they did is that there's a program in Madison where, because about in spring, the food pantries are empty because, you know, at Christmas and Thanksgiving, everybody's donating food. Come spring, the kids that are in free and reduced lunch are going home to their homes where they don't have food. So there's an outreach program in Madison who sponsors something called the Construction. So the kids designed and built, but actually it was all, you know, it was like Findorf and Milligers, or the Bruce Company, which is comparable to Milligers. The big companies up there, American Family, they were having these constructions where you take cans of food and you build structures and then they have a contest. The Middleton kids were the only high school team. This was the second year they made Big Ben out of cans. I had to go pick up, they raised money. They raised all the money for this, and I went over to Sam's because I had the district card, and I had to buy 83 cases of baked beans. So that's what you see in that structure. But they actually won first place, and I have never seen kids so proud. But what they did is that they did all that programming and inventors, so they used all the skills they learned in Introduction to Engineering. They learned how to present. They would go and they would put flyers in bags. They had a marketing team, they had a project management team, they had a procurement team, they had all these. And I'd say, can I help? No, Miss Testman, we're fine, go sit down. And they did all of this, and they did it on their own. They went door to door, put the bags on, they had a map, they mapped out the areas, and went door to door, said, well, you know, this is who we are, this is what we're doing. You know, we'll come back, and, you know, the next Monday I opened up the back door and cars are pulling up, unloading bags of food. And these kids did all this. And if you could read some of the reflections they wrote, some of them they made you cry. I never knew that I was really good at being a leader. You know what? I always thought I was a good leader, but I'd rather work for people. The hardest thing about this project was to get kids who didn't want to work. I never knew, I didn't know this about myself. I found out I'm real creative. I found out that if I apply myself, I could do great things. The other soft skills, the fact that they decided, you see how they're all in khakis? I said, I don't care what you guys wear, but you're all wearing the same thing. They called Land's End, they got those shirts donated, and they said, we're all wearing khakis and no tennis shoes. That wasn't my choice, that was theirs. So you see the soft skills that people are talking about they don't have. That's why service learning is important. All the kids will have a time where they can come together. They will meet one time during, like the school days broken up into one A day, and the second day is a B day, and then they repeat that cycle. Within that cycle, they will get together. We're going to have things with soft skills. We want them to be a community. We are going to have people coming in. It's real important that the community is involved. They start seeing what else is out there, what other careers are out there, but also people saying, this is how I was successful. This is what I did to become this. If an entrepreneur comes in and says, this is what you need to do as far as patenting, this is what you need to do with a business plan, those are all the soft skills and all the other important things that the kids will be learning as part of the En-ROADS program. The self-paced blended learning class, this is going to be something that, again, where the teacher's there one day and the other time that they're working on things. And again, this is making them career ready. How do you plan? How do you allot time? If you have questions, how do you approach somebody about doing those things? And the things we really want them to come away with is confidence, exposure to what things are out there for them, and learning what they don't know. A lot of times kids don't know what they don't know. Shoot, I don't know what I don't know sometimes. So that's really important. Upcoming and ongoing events, again, I'm going to be going out in the community, and I want you guys to be aware of kind of what this program is in case people approach you. The presentation in next year's courses will be done on the 13th. I'm going to start talking to middle school staff and parents, and I'm going to continue to meet with the Brian Albrechts, the Brent Kindreds, and the other people in the community. I've got a couple set up with the community leaders, and if you guys are aware of people that are really, really vested in kids that want to help out with this, please send them my way. Does anybody have any questions? I'm sorry, yes.
I may have you beat for older than dirt.
I'm getting close to dusk.
I was in school with slide rules as well. I paid $125 for my first calculator, and it didn't even do, I mean, it does what it...
The four basic functions.
Yeah,
And
exactly.
it was a TI-90.
Exactly. And even at that time actually, women were being highly encouraged to go into engineering. And I know that the engineering field has become less so since I graduated from college. And there aren't as many women as they would like to see. So how do you propose to encourage girls to get into this area?
That's a great question. And I think the biggest thing is that they're finding is that a lot of girls still equate engineering with shop class. That's what the feedback is. The things that I have worked on that is I went out to Carnegie Mellon and took the ALICE course, which was trying to get more middle school girls involved in programming. That has not as big an impact. The thing that I find has the biggest impact is you start offering GTT or Project Lead the Way middle school program in middle school. And you don't just put it in the tech ed, you put it into the science department where all of the kids take it. And the kids start seeing, hey, this is what this is cool stuff, I want to do this. And so when you embed it in the science curriculum, the parts of the modules that Project Lead the Way has for middle school science has to do with robotics, it has to do with green engineering. It has a lot of things that if it's part of what the kids are taking and it's not an elective and it's just built into the science, because kids need to have physical science in their curriculum. That has been the thing that has given me the most success and actually in the nation to get more girls involved in engineering. It is a real dilemma.
I know that the 7th graders in particular, though, used to get that tech ed portion, and then I think in 8th grade they have a few more. Courses they can select outside of that area.
Right.
So I would suggest, if I may, that perhaps 7th grade might be the area where you talk to the parents.
I totally agree with that.
And then, if I could mention one other thing, my daughter, my youngest daughter, she took a class at Madison over the summer. There was an Engineering for Girls program. I don't know if it still exists anymore.
It does.
But if we could somehow encourage the girls to do that.
There's a couple things that I would like to do. One of the things with the computer class is right now my kids are learning how to program apps for an Android device using MIT App Inventor. I would like them to come back and I've talked with some of the admin about this, is to run a summer camp, especially, and have one that's just for girls. They become the teachers. So these kids in middle school will be making their own computer apps that they could load up on their phones or, you know, on some devices, and they could do those games. The other thing is with the next generation science standards, they have put into them, they have built engineering requirements into the next generation science standards. And I talked with the lady that at the DPI, Wisconsin's going to have to go to that because they don't have anything else to replace the WKCE, and they're going to get a canned package, and the canned packages right now are being all designed around next generation science standards. I share your interest and passion in getting girls involved. I went out to and I paid my own way. I went out to the Boston Science Museum. They have a program out there called Engineering is Elementary. I've talked with Lenny Zurich about putting it in. I paid to become a teacher. I could teach the teachers here how to do that program. That is the most phenomenal program that there is that teaches engineering that I have seen. Project Lead the Way is starting one this year. I would endorse Engineering is Elementary. If you want to get on that site, that is phenomenal, and it does address all the kids. And they use a 5-finger model to do design process because kids can count on 5 fingers. But they start out with 3-year-olds and 4-year-olds, 5, 6, 7, and 8-year-olds, and they do the design process. And the kids start becoming aware of how to solve problems, and that's starting them at even less than middle school. They're starting them in elementary school. The nice thing about that is they have some free programs that you could download for after-school programs that you could use them at the elementary schools. You could also use them in Cub Scouts or Girl Scouts or 4-H. But I would like to get my kids involved in the service learning to start doing that after school at every single elementary school in the Franklin School District. So that's where they're also doing it if it's not part of the curriculum. But you're on the right track, and that is extremely, extremely important.
And just so the board it doesn't get too worried, we will find some additional things for Terry to do. We're really excited to have her because I think this is going to turn our district sort of upside down in a lot of areas and really take us into the future. And Terry, we're very pleased to have you. And I know Nick and Mike have been really actively involved in this whole thing. And a lot of these things are in the coordination with everything we're doing from a curricular standpoint and the future classes that you'll be hearing about. But we're not letting this, the dust settle underneath our feet. We're moving pretty fast, and Terry, we're glad to have you here, and thank you.
Yeah, I'd love to see you bring a group of kids to the state convention. We always see, we've seen them.
School board convention?
Yeah, the school board convention.
You might see me there because they asked Middleton to come show how to incorporate service learning into projects. That they want me to bring some kids and do their construction project.
We want you to bring our kids then.
Well, I know it's in January, so.
Yeah.
Not quite ready yet.
Anything that's good for kids, people say, how do you get so passionate about it? And it's like, it just happens. Kids are wonderful, and they really embrace this stuff. And how can you not be happy when somebody makes that kind of difference in their life? So.
Thank you, Terry.
Thank you. Okay. Item 9E is the summer school update.
We had asked Karen Knoll, who was the principal at Country Dale, to come in. Karen runs our summer school program, and to give the board just a sort of a general overview of what is taking place in the summer school program in terms of numbers and so on. So Karen, I'll turn it right over to you.
Thanks. I have some brief information to share. I'm happy to share with you this evening, and thank you for inviting me. I'm not happy to have followed Terry. But I should talk to her about summer school possibilities. She is amazing, and boy, she makes me tired just listening to her. Just to share some very brief information, our enrollment in summer school this summer was 900 students, and that's broken out into the majority being obviously in our elementary summer school. We had 543 elementary students participate. In addition to those students, we had 185 band and orchestra camp students. We had 68 middle school students participate, 102 Franklin High School students, and out of that number, 2 non-resident high school students. So that was the enrollment in a nutshell. I can speak more specifically about elementary classes and staffing because obviously that's my role. We had 14 enrichment classes and we should broaden that with some expertise from Terry. My wheels are already turning. We had 15 supported classes, and our supported classes obviously are just what you would expect. They're to support our academically at-risk students in the area of math and reading. 2 years ago, we added reading intervention, which kind of was a branch from what we were doing in the elementary schools around our response to intervention. We added that into summer school with our reading specialists, which was a great addition and really added not only to the reading support that they had historically in Franklin and summer school, but also added more expertise with a much smaller group of students working with a specialist in reading. And that continued into this summer school year. And then thinking about that same kind of a model, we also made an adjustment with our math supported classes to have more of an intervention model with that as well. It still was a larger number. It wasn't the small number that we had with our reading intervention classes, but those classes were set up as a function of doing assessment prior to the students being placed in those classes. So those students were placed not according to age, they were placed according to what module in the intervention that they needed for math. So they were cross grade level, but they were all in similar classes based on what they needed to support them mathematically. We had a total of 416 students referred by our teachers in the district for those academic supported classes, and of those 416, 250 of those referred attended, so 60% of the total population that we wanted to reach out to. As far as staffing, 28 staff were hired to teach the elementary summer school, both the enrichment and the academic supported classes. And we had to go outside of our district to hire all of the teachers that we needed. There were 9 of the 28 teachers who were external teachers outside of the Franklin School District, or 32%. So that's kind of summer school in a nutshell. Any questions I can answer?
So some of the students took summer school, obviously, so they could not be retained?
No, it wasn't that they were at risk of, you know, being, having to repeat a grade level, not in the elementary in any case, but they just needed to have more support in reading or math to close the gaps that we work on during the school year in our response to intervention model.
Okay.
So just more time with some prerequisite skills that maybe aren't part of that second grade curriculum, that they need to kind of back up and revisit some of some skills from a previous grade level.
I see, thank you.
I know one of the high schoolers that attended was my daughter, but she did so she could take the Phi Ed in the summer school and not have to take it during school. That allowed her to pick up an extra class on an extra AP course. So I thought that was really nice to be able to do do that situation there. So.
And it is a wonderful service to our community. You know, the enrollment is pretty high. It's actually, with both the enrichment and the supported classes, we have over 600 students. So dismissal is an adventure.
It's those drop off.
It is.
Do we
It
provide
is.
transportation?
We don't. The transportation is at the end of the day. So for example, our students who leave summer school may actually go into Kids Club, which is our after-school program. And so they're there actually in our facilities the full day, but the summer school program ends right in the middle of that day. And so if a student is not going to Kids Club, they have to be picked up by their parents. It's Kids Club that receives transportation at the end of the day. Thank you very much.
Thanks for coming.
Thank you.
Item 9F is the Board Goals Committee update. And I believe on our committee, we had Mrs. Schlueter, Mr. Alexandrovich, and Mrs. Larson, and Dr. Patz.
Do you You guys want to speak to that, or how would you like to do it?
I didn't prepare anything.
Let me jump off and you guys can jump in, okay? We met, one of the directives from the retreat was to find a way to engage the community, get community input, community feedback, and so on and so forth. When we met, we sat down, we talked, basically tried to generate some ideas of what are those big issues that people seem to have a high interest in. And we said, well, the budget. Well, we don't get many people involved in the budget, and they don't look on the website. We don't get phone calls. We said, okay, let's put that over here. And we talked about several other things too in terms of what's going on in construction and so on. But in the end, we came up with the idea that, we have a big issue that's going to be coming up, and that's the boundary adjustment. And we think that that's going to probably require a great deal of board input, a great deal of opportunity for board to hear and see input at the World Cafes that we'll have at all the respective buildings. So I believe it was, if I'm speaking correctly, it was the thought of the committee to, each board member already has a liaison building assigned to them. And so we're primarily talking elementary in this case, however. So what we would do is have that person who's in charge of that particular building plus one. So one other board member, and we didn't decide how that other board member is elected, or maybe the person who's hosting that school can invite somebody. Certainly you can all attend, we're not restricting it at all. But what we wanted to do was have all the board be involved in all 5 of those meetings to be able to come back then and have a discussion on, here's what I heard at this building, here's what I heard, so that you have a good foundation of what the community had to say regarding that issue. So when ultimately the final decision has to be made in terms of what we do for the boundary redistricting, that we've had a lot of input, you've had a chance to hear it both from fellow board members as well as your attendance at the meetings, and that would be a pretty big apple to bite into, we thought, for the year. So did I state everything correctly? Yes.
The only thing I would disagree with you on is that we said that we wanted to keep it as a board member, the liaison plus one, and leave it at that.
Yep.
Because we felt that when we come in as a big group and we're all there, it tends to be intimidating to parents and to community members. So we said that, for example, Alan and I would maybe attend Southwood Glen's listening session, and then Alan and I would come back and report to all of you.
Right.
And then Amy and Janet would go out, and they would come back and report to us. And then we also thought that we may have to call a special board meeting for us all to get together and then talk about all of the things that we saw and that we heard. But we definitely agreed that we would not make a decision. We would not expect the board to make a decision until we had heard all of the options presented. But the one thing that we did say is we really wanted to keep it as a liaison plus one at each of the listening sessions. And then, of course, administrators would be there.
When do those start?
Well, we just had a meeting, what day was it, Monday? With our consultants, and so we're still dissecting a lot of data. We hope to have them in November to start off with. They've gone back. What they've done now is they had the geocoding all done where they've had the dots put on the board in terms of where everybody is. We had a chance to say, okay, here are some things we want to look at. What if we pull open enrollment kids out? What if we make boundaries contiguous? What if we just say if you're in one attendance area but you're going to school in another attendance area, what if you went home and had to stay in that attendance area? What's that going to do for our boundaries? Because those are the questions we think we're going to get from people, and we have to be prepared to answer those right out of the block so we sort of look like we know what we're doing.
So you want to do a little prep work before you have these meetings?
Exactly.
That's what you're talking about.
Exactly, yeah. So it'll be November, December before we have all those completed, for sure. And there's something that's going out, Megan already has it prepared, that'll be going out to the elementary. We'll put them in the backpacks and so on, going out this week, and then we'll have something on the website, and we'll make notices throughout when we're going to have those and where we're at currently on the status of that project. So that's it.
Good job.
Any questions? Thank you. So we're going to have meetings before the holiday, before Christmas, and there's going to be meetings at each site. Did I hear that right, or?
Yeah, at each elementary school.
Okay.
Yeah.
Okay, and then, did anybody meet with any of their alder persons? Okay, you want to go first?
Sure, yes. I did call Dan Meyer. I wasn't able to meet with him because he's a busy guy, so thought a phone call would be nice. And the conversation was friendly. He didn't know who I was. I didn't know really anything about him either. I was surprised to hear he had been on the school board for a couple years. He did not finish his term. I didn't remember that, but I guess it was early 2000. Kind of asked him how he thought the city and the school related to each other. And he did make the comment that our mayor always does say that the school district is the largest taxing entity on the tax bill, and I guess that's true. So that's what he, I don't know if that's good or bad, it's a fact, so. I don't know if we really agreed on, he did say that he did remember that there were meetings, actually, with the city and the board during that time. I don't know if he really thought it was beneficial, but he recalled that we did that. And I can't say we came up with any common issues, but it was good to make the contact and just let him know that, I can call you or you can call me. So that's where we left it at. But I did make contact, so.
And Melissa, yours got canceled, or did you meet?
We rescheduled and we met Monday. I was assigned to Steve Taylor, who happens to be my alderman. And I had met Steve a couple times before, but this time we, strictly talked about, school and city kind of issues. He was very interested in the facility changes that we're making, and I gave him a little bit of information about the Sabre Stadium project. He was interested in that also, and he said, I really think that we need a turf field. So he's a big fan of our sports, and he comes to, his personal schedule permitting, he comes to a lot of football games and basketball games and things like that. So I'd say he's a pretty good proponent of our schools. He is considering running for mayor because the current mayor is not going to be running again. And generally, we just had, kind of an informal but a nice chat, and hopefully he'll feel comfortable calling, me if he has any issues, and I know I would feel comfortable calling him. He's also a county supervisor, so he's also an extremely busy guy, and he's a newlywed. He just got married in June, and he has a stepson now, so he's got a lot on his plate, but a nice guy.
Thank you. I met with Mayor Taylor, and when I went to meet with him, he happened to call in Mark Liberta. Mayor Taylor, as Melissa said, is going to be leaving in April, and the first thing he said to me when I walked in was, why don't we meet together anymore? Meaning the city council and the school board. And so we brought up the conversation of that in the past, we had heard that there were bad feelings between each other. And he said he believes that all the negative council people are gone now. That they're not on the council anymore. And he thinks that it'd be a positive thing that we started meeting again. He'd be all for that, even though he is leaving, and he believes the current council would be in favor of that. You may have heard that he is in favor, even though, again, he is leaving, of giving some of the duties of the mayor over to the city administrator, who is Mark Liberta. So that has to be discussed further. One of the discussions that came up, and that will be just mentioned down on future agenda items, and was brought to my attention by Dr. Patz, was the impact fee issue in the city and between the school district. And because Mark Liberta was in the room, I brought that up, and we are being charged impact fees, and so that's a future agenda item. But one of the things we talked about, and I have it, Megan has it in our library now under
Extra board resources?
Extra board resources, if you want to go into the board library, and she's got a couple handouts if anyone in the audience wants it. But there's an article in there called Introducing the Left Hand to the Right Hand, the Benefits of Annual Leadership Summits. And I put that in there because it tells just a brief summary of why it is good for us to get together and not have a meeting with a full agenda with the council and the board, but just to get together, even just annually, as a summit, just to meet each other and exchange ideas and not try to take each other's turfs over, and that is why he thought the council did not get along with the board back then, because they were trying to tell us what to do, and not so much the board tell them what to do, but the council tell us what to do. And he really does think it would be a good idea to get together. He talked about the Frumming Park issue, which, Tim, you brought up the other day. Was that still an issue where we might be able to get that land? He would like to see something in the future, hopefully something in the future where some land could be gotten so that we could share something like Hart Park in Wauwatosa, just so we could share some kind of services together. And the way to do that is for us, again, to get together and talk. We had a short meeting, and basically that's what we talked about, was meeting with each other. So, and I think that's what all our meetings are about, getting together with the aldermen, just communication, as we talked about with our goal, and getting that first meeting together. So, did anyone else meet yet? Okay. And that's it. And next we move on to item 9G, Board Superintendent Roles and Responsibilities Introduction.
Before you have a blue handout, this was a handout. Jan and I had been discussing this topic for several weeks actually. We always had discussion about superintendent responsibilities versus board responsibilities, where do they overlap, where are the gray areas, and so on. So we thought it would be a good idea for us to be able to start having some discussions on that topic. And so what this is just sort of a talking point for you to take and observe. And what we would like to do is down the road in the near future schedule a dedicated time to talk about this particular issue. Because it should be something that's talked about in isolation, so we can really get into it, so to speak. So I think it'll be valuable for all of us. This is happens to be a policy from the Mequon School District. Janet and I looked at, I think, 3 or 4 others, and there are certainly more out there with what people do. So there are different things to look at in here that some of this may apply to us, some of it may not apply, but I think it's worthy for us to have a starting point, and so it's just for your information right now. And then we'll be scheduling a time where we can get together as a board and superintendent to discuss this as an agenda item topic as we move forward, possibly in a retreat environment.
Is this for the purpose of creating a policy, or do we have a policy?
We don't have.
We do not have a policy.
Right.
Okay.
I think it's both, Tim. It's whether we may or may not want to have a policy, but I think it's a worthy topic to have discussions on, just so comfort levels more than anything, probably. So if you'll just hang on to that, we'll be getting more information to you.
Well, actually, we did schedule the meeting for this. This is our December special meeting.
That's right.
Yeah.
Oh, on the 4th.
That's where we will have more paperwork at that meeting to start as a base to go over.
Right.
So if you do read this over and come up with some of your ideas to bring to that December meeting, but the idea is that we want to be, open and honest about our feelings about this. Okay. And we are on item 9H, Treasurer's Report. Mrs. Witkowski?
Okay, cash balances as of October, end of the month? Or this month? What is the date?
Would have been last week Thursday.
Last week Thursday. 2013, general fund has $13,383,448, and the debt service fund has $2,578,368. Prior to November 13th, we anticipate cash requirements in the amount of $4 million for the October 31st and November 15th payrolls and accounts payable.
Are there any questions? All right, thank you. Item 10 is the board meeting debriefing. Does anyone have any comments?
I like Mrs. Tessman.
We all do.
I wanted to go back to school.
Yeah, we're very lucky to have her.
Push my son into that.
Anything else? Okay, thank you. Item 11, future agenda items. We have a budget update and tax levy approval on November 6th. And can I also add about the budget? When did, Alan and Linda, did you want to come back on the budget again, on your budget committee?
When did we come back?
Yeah. I know, Dr. Pats, you said you wanted to get together and talk to the administrators. Did you get to do that?
We talked a little bit about it,
Okay.
and so it's, if you're gonna, maybe the time to do that is on the 6th, I don't know.
Well, you won't be here on the
13th,
6th.
13th, Jim, is that 13th?
13th would be good.
Okay, and then we have the FHS pool proposal on November 6th, and then we'll also have the insurance update again on November 6th. And new course approvals, November 13th, youth options on November 13th, state report card overview, November 13th, and impact fee discussion, November 13th, and that is what I was talking about in my, with the meeting with the mayor. Dr. Pats, you said you would get some information out.
So with the dollar amounts and stuff.
Yeah, to the board ahead of time, to give you some information on what we'll be talking about. Mr. Liburd is going to come to our meeting with information about impact fees and give a presentation to us, so Dr. Pats will get you some information on what the city is charging us. And then we'll be able to ask him questions.
Can I just make a comment, John,
Sure.
on the report card? Mike had sent you, that went out, Mike, the report card?
Yeah.
You know, Mike had touched on it on his report, I think it was last month or recently, so there's not going to be a great deal of overview that'll take place because all the information that we have is in your hands right now. So if you have anything that you might have questions on, feel free to forward them to any of us, particularly Mike, who's well-versed on that and is dealing with that in his area. So just so you know that there won't be additional information going out on that.
Do I hear a motion to adjourn?
I'll make a motion to adjourn.
Motion by Mrs. Klein, is there a second?
I'll second.
Okay, all those in favor of adjournment, say aye.
Aye.
Opposed? We are adjourned at 8:16.